NPR.
You're listening to WMNF Tampa, broadcasting in West Central Florida and around the world on WMNF.org.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Hello there, my esteemed listeners on the soft-rolling streams of the radio waves. You never cease to warm my heart because you keep your radio tuned to WMNF Tampa, the resistance radio station from Tampa Bay to the Gulf of Mexico, and the only sapient little FM station that Maud Frickert would ever stream. And you can stream us as well at WMNF.org. In the more immediate and front and center aspect of the Healthy Steps radio show, today we have the pop quiz edition that we like to call Ask Me Anything Monday. If you have any medical questions or concerns, please give us a call at 813-239-9663. So jot this number down and put it in your notepad. Give us a call at 813-239-9663. You can also send an email to dj@wmnf.org or text us at 813-433-0885. And a spectacularly good Monday morning to you, Dr. Harvey. Let's launch this show. What have you got for us today, Dr. Fred?
Well, good morning, Bill, and all you Healthy Step listeners. I hope your weekend was wonderful.
Absolutely, mine was, and looking forward to another week, but certainly that week being inside the AC.
Yes, I spent a little bit of time outside the AC last week because the Thursday morning early was the peak of the Perseid meteor shower. So I got myself out of bed about 4 in the morning and laid in the under the stars for a half hour and saw about 9 meteors.
That's pretty good, and it's well worth the effort there. I didn't make that effort, though.
Yeah, I don't blame you. It was not as good as ones I've seen in the past, and really quite humid. But it's funny. Right after last week's show, when I was talking, I believe, again about vaccines, that felon who inhabits the White House issued Executive Order 14420. And it's really a funny title. It's called Gold Standard Childhood Vaccine Recommendations for Americans. The reason I think it's funny is because the use of the word gold brings to mind the story of King Midas. I don't know if y'all know the myth, but he's the guy that got a wish, one wish, and he wished that anything he touched turned to gold. And it reminds me of the golden Oval Office now and everything that he wants to paint gold. But, the allegory of the story of King Midas truly is unbridled greed, destroys everything that matters. Because, he touched his lunch and it turned to gold, he couldn't eat it. He hugged his beloved daughter and she turned to a golden statue and she was gone. And so truly, wealth is not everything, and human connection matters the most. And the big one here is be careful what you wish for. And this new executive order is rather ridiculous in its scope because it's not a gold standard. It's far from it. In fact, this weird approach to attacking the manufacturer of these medications. They have a fantasy that everything in the world can be perfectly pure when we live in a polluted world. It's really not possible. They want to find the reason RFK is on his rampage across healthcare is because he has believed for years, and in his job as an attorney, he sued people because of apparent alleged vaccine injury. But yeah, he's basically, his witch hunt against autism creation is stalling because, well, one thing, they missed the deadline to release the report. They released this massive trove of stuff that was kind of meaningless a month ago, this committee for assessing autism. And they think that they'll find a single culprit, which is a fantasy. They're not going to find a smoking gun because it's layers of stuff. We in functional medicine know it's layers. Trying to clean up the vaccine, which has already been cleaned up. They've taken the mercury out. They've taken much of the adjuvant, other stuff out that's not needed. They leave in the things that are needed to make the vaccine effective and safe. But RFK Jr. wants, to eliminate any kind of perceived over-vaccination, but, well, it's only perceived by vaccine skeptics. Well, so why are we actually helping with their delusional perception of a fantasy when in actuality, the reality is that what they're proposing here is to make it harder for people who want vaccines to get vaccines. And so what we see here is that they're wishing for this change and they're getting it, but the change is deadly. We have an outbreak of measles in our nation that we haven't had before. So this branding of gold standard science over actual science is really weird. It's really dangerous. And I just read that his new committee to evaluate vaccines is basically populated with vaccine skeptic doctors, parents who've had children they think had vaccine injury, and it's just being refuted back to back. I mean, a recent study just published in August in JAMA Pediatrics found no evidence of this. Like hundreds of thousands of people. I talked about that last week. And so they're trying to hide everything. They canceled millions of dollars of funding for research that was intended to help find autism's causes, including the potential environmental sources, because I believe that the amount of poison that we have in our environment, in our food, is actually contributing heavily to this issue, as it is for most of our degenerative medical issues. And it's just really frustrating to see that we have nonsense, non-science, and non-scientists making these decisions for all of America. It is really a sad position that we find ourselves in. And this is just the tip of the news on these kinds of things. We're looking at destroying stuff that actually worked so that we can have some political points. But there are other things in the news, and I just wanted to remind people that this is a call-in radio show, and I am Dr. Fred Harvey.
It is so much more than just a call-in radio show. It is the Healthy Steps radio show with Dr. Fred Harvey here at WMNF Tampa. And we are encouraging you to participate. Just give us a call with your medical questions or concerns, dialing 813-239-9663. Again, that number to call or dial is 813-239-9663. And you can send your emails to dj@wmnf.org. Back to you there, Doctor.
Yeah, so no callers on the line yet, so I'll move on to some different kind of news. It's summer, and a lot of people are outside, and we have a big outdoor problem. In addition to the heat wave that's really deadly and has killed, I believe, 16,000 people in Europe already, we are looking at a continued tick disease explosion. There are just so many ticks. The rates of Lyme disease, have doubled in the last 25 years. And 8 new tick-borne diseases have been discovered. And so we are looking at all kinds of new challenges, including the unusual and now actually increasing in frequency, the tick-induced meat allergy called alpha-gal syndrome. So climate change is winning, and the tick populations are exploding. And what's been fortunate, I've been out in the woods. I just said I was looking at the meteors. Fortunately, I've not been seeing many ticks here walking in the high grass in Florida. And I look at myself every time I come in from the outside to make sure I'm not going to keep them inside with me. And because the longer you leave it on your body, the more likely you're going to have a transfer of infectious material from the tick belly into your blood. And so the issue with these ticks is that, we've had huge increases in the deer population. Winters have been milder, deers have survived them, and they love deers. These are deer ticks. And so we're seeing the ticks flourish with the flourishing of the deer population. One of my friends was on Fire Island a year or two ago and said that the deer out on Fire Island are really like scary looking because their entire ears are covered with ticks when they walk around. I haven't seen that, fortunately, but I believe that we have stimulated some interest in talking.
Indeed we have. That was a pretty good shout out. I've got Rick, John, and Andy on the line. So let's go to Rick in Clearwater. Good morning there, Rick.
Good morning.
Hi, Rick.
Hey, how are you?
I'm doing well. How are you? What's going on today?
Well, I have been diagnosed with a fatty liver.
Yes.
And my gastro told me no drinking and exercise, anaerobic, 7 days a week, 30 minutes a day.
Okay.
Nothing else. There's nothing else you can do. And
wow.
Having looked at Eastern medicine and so forth, there's lots and lots of things. So I was wondering what if you had a recommendation on a supplement or...
Well, actually, the first thing to do is to find out why you have it. Were you drinking excessively?
Not excessively, no. I'm a...
How many ounces on average per day over the course of a week?
About 2 a day.
Okay, and that is enough in certain people to cause this, but it's not the usual circumstance. Do you have diabetes or insulin resistance?
No.
Do you have metabolic syndrome, high blood pressure, extra belly fat, bad cholesterol?
No.
All right. So the next cause that I would consider is sleep apnea. It is a significant cause of it, and many people have it, and it's often silent.
Sleep apnea?
Sleep apnea. If you have it and you don't get it treated, you will continue to have fatty liver to the point where it will fail. And it is a significant risk factor.
What about the supplements, the NAC, the choline?
Yeah, they're wonderful, but they will fail to recover you if you have a cause that's untreated. It's worth it to pursue causation before you pursue treatment, but you can start supporting your liver now with N-acetylcysteine, milk thistle, B vitamins, good protein intake, limited fat intake, no fried foods. These are all good things. Limit your sugar intake.
I've changed my diet to a strictly Mediterranean diet, cut back on the alcohol and so forth.
Well, if you have fatty liver, you really need to just abstain from alcohol. There's no reason to drink alcohol when you have fatty liver. In fact, the reason to drink alcohol in fatty liver is to cause slow suicide.
Okay. So, from what my understanding is, it's basically a cocktail of different choline and.
Yes, those are some good supports. Those are some good supplements. But I'd rather not talk about treatment until you figure out why you have this, because treatment may be eliminating sleep apnea.
Well, my wife has never complained about it. She had it, and it was horrible. You could tell she had it. She's never recommended, that I was snoring or...
Yeah, sometimes it is silent.
Symptoms. Sleep apnea is silent. Huh.
Yeah, you don't have to snore to have sleep apnea.
How does the fat accumulate in the liver because you're not sleeping? That's
because the sleep apnea causes physiologic changes that result in abnormal liver metabolism, abnormal sugar metabolism, and other things that then lead to the impaired liver metabolism and the storage of excess fat.
Oh, okay. Well, should I continue with the supplements until I can get in for a sleep test?
Yes, I would continue supporting your liver because they are good supports. They're just not going to fix it unless you get fixed. There's a reason you have fatty liver. It doesn't just pop out of the blue. So you need somebody to help you evaluate that. An overnight oximetry test is something that some clinics provide before you go to a sleep study. Yeah, you might just want to ask your doctor to order a sleep study to see if you have it. But you deserve a further workup because your gastroenterologist is lazy and tells you there's nothing else to do. I think, it's worth it to find out why you have it instead of just letting a gastroenterologist label you and say, okay, you're going to die. Bye.
Okay, well, what was that one test you said prior to a sleep test was a...
Overnight oximetry. You measure your oxygen overnight.
Okay, and that's outpatient or something?
Yeah. I in my clinic dispensed a little kit to take home, and then you brought it back, and we saw what your oxygen was overnight.
Oh, okay. Well, thank you. I'll give that a go because why not?
Yes.
Okay. Thank you.
Yes, you're welcome. Good luck finding out why you have this fatty liver problem.
I appreciate that. Thank you.
Mm-hmm.
And thank you, Rick. Appreciate you calling on in, and certainly good luck with that, finding that answer. And I do have John and Andy in the queue, but I want you in the queue as well. And you are invited to participate to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Just give us a call with your medical questions or concerns, dialing 813-239-9663. Joe is in the control room handling the phones, and I'm very appreciative of that. So take advantage of it. Give us a call at 813-239-9663 or send your emails to dj@wmnf.org. Good morning, John. How are you doing today?
Good. How are you guys?
Doing well. What do you have for us?
Okay. The other week I went to give blood, first time I ever given it, and they wouldn't take it because my iron was just a little bit low. And in the last probably 4 or 5 months, I just don't have any energy, and it seems like I just sleep all the time. I mean, I go to work and stuff, but when I get back to the house, I don't feel like doing anything, and I go take like a 2-hour nap or something.
And how old are you, sir?
69.
So, low blood iron and fatigue are often a hidden sign of an underlying malignancy. I think you need to go to your general doctor and get a complete workup for why you have iron deficiency. You can lose iron through a colon cancer, through an ulcer, and through other methodology.
Yeah. No, I'm going to him next week. That's been scheduled for a while. But anyways, other than their regular blood test, is there any other type of test that I should have taken from my blood?
Well, when was your last colonoscopy?
Like last year.
Oh, and that was clear?
Yeah, I had one polyp.
Oh, very good, very good. So that sounds safer. Well, I think that an iron panel, a stool blood test to make sure you're not leaking, and a full metabolic workup that a normal doctor would do on an annual exam, I think is worth it. And if you have any other symptoms of bleeding or anything like that, you would mention them and pursue them. A chest x-ray is probably in order if you have a cough, but if not, maybe not. Yeah, I think you need to be seen.
No, like I said, I'm supposed to go into him next Friday.
Yeah.
But just the basic blood work he does, that would be enough to tell me something?
I think it's a great start, that with an iron panel, so you can find out.
Let me write that down.
Well, if you tell him you have been denied a blood donation because your iron is too low, he's probably going to order the iron panel.
Yeah,
but otherwise,
when I go give my blood, I would rather have it done then before I go to see him. Because I always have my blood work done like a few days before I go see him, so he's got it in his office, so I don't have to go back and have him explain to me.
Yeah, so you might want to just call them up and say, look, I have low iron. Can you put an iron panel on there?
Yeah.
I think you have to get this evaluated one step at a time. So let's find out why you have low iron rather than just speculating in the dark and adding an iron supplement or something like that.
Yeah, because as far as I know, I've never had it before in my blood work. I just
so there's something new.
Yeah, exactly. But the other thing is, should I take iron supplements?
No, you should actually see your doctor and find out what's going on first.
Okay. I didn't know if I should start taking them or not.
No, because that will change the blood work. You might as well go in as you are now, find out what's going on, and then make a plan for treatment and evaluation.
Okay, I'll tell them to do iron panel on top of the other blood work, and then I will see what happens, and I will be back in touch with you.
Okay, great. Look forward to it.
Thank you, Dr. Harvey.
You're welcome.
Yeah, and thank you.
Good day.
Thank you too, John, and we look forward to hearing you again. Keep us posted.
Bye-bye.
Bye. I've got Nancy in St. Pete on the line. Good morning, Nancy.
Hi. I'm getting the impression that people who are not very active get spinal stenosis. I want to know what you know about spinal stenosis.
Well, spinal stenosis is a description of a chronic degenerative arthritis disease of any parts of the spine. Stenosis is a Latin word that means a tightness, a closure. And so when we talk about spinal stenosis, it means that the inflammation has caused calcification of the ligaments and tendons around the spinal joints, resulting in a tightening of the central canal where the spinal cord travels. So spinal stenosis can, over time, proceed into something that's extremely painful, and that's also risky for nerve function. Sedentary behavior doesn't cause it, but sedentary behavior contributes to the progression of it.
I see. And do they go in and ream it out or something?
Depends on what's going on. Sometimes, if you catch it early enough, some exercise will work. Sometimes chiropractic can help. Class 4 laser is another tool that seems to control the pain. But spinal stenosis is one of the few spinal conditions that I think responds well to surgery, unlike a standard disc surgery, which often fails because people never change the habit associated with the disc herniation. the spinal stenosis causes an inability often in people to be able to stand up for very long or to go walking because the erect position causes the pain. And so they will often go in and do what's called a laminectomy. And the laminectomy is removing one of the wings that comes off the spinal bone. And then they do something called a fusion where they actually, since that's now destabilized, they put a rod in that holds it together. And sometimes they'll do multiple levels at once because that relieves all the pain in the area and they don't have to go back in. I know one client that didn't like that idea and did one vertebrae, and then they did 2 years later another vertebrae, and then 2 years later they did 2 more vertebrae, and now they have no pain from that problem. But they did have 2 years of pain-free existence between them, and then had to get surgery. So spinal stenosis responds to physical therapy and to sometimes class 4 hot laser, and sometimes you have to actually go to surgery.
Okay. Thank you.
You're welcome, Nancy. I hope you feel better after you pursue this. There's lots of good options for you.
It's a friend of mine.
Oh, okay. They should see a neurosurgeon for a good opinion.
Is the arthritis caused by allergies? Food allergies?
In spinal stenosis, it's usually caused by poor posture, leaning forward when walking for 50 years and destroying your low back because you have been sedentary and you don't do back exercises to keep it in the right posture.
Oh, okay. All right, thanks.
You're welcome. Have a great day.
Thank you there, Nancy. And we're down to the last about a wee bit under 30 minutes left, and it may be time to look at some emails there, Doc. I've got nobody on the line, and that makes me a little miffed. I'm inviting everyone to participate in the Healthy Steps Radio show today with Dr. Fred Harvey here on WMNF Tampa. You're encouraged to give us a call at 813-239-9663. The rush is on, so be the first to dial 813-239-9663 or continue to send your emails to dj@wmnf.org. What have you got there, Doctor?
So Randy in Palm Harbor texted us to ask and say that I'm a native and I was a sun worshiper for many years. Besides staying out of the sun and seeing a derm MD regularly, is there anything proactive I can do to help myself not get cut up for spot removals? Well, there is, staying out of the sun is not necessarily the case. I go into the sun regularly. I like to do it before 10 and after 4 because that way I avoid peak sun, peak UV rays, and spare my skin a bit. I do see a dermatologist every year for a check, and then there's some other things you can do if you're older and you're developing skin changes. I had a lot of sun damage on my bald head, and I got a procedure called blue light, which takes away a lot of the damaged cells so that hopefully there won't be a deterioration into cancer cells. Also, certain nutritional supplements seem to have some benefit there. Green tea extract and resveratrol both seem to have some activity in reducing the amount of skin cancer, as does potentially vitamin D and vitamin E and even vitamin C, but none are treatments. These are all just things that you could do daily just to make your body more healthful. I think we have a new caller.
Oh, not just a new caller. I've got Lisa, Ken, and somebody else ringing right on in right now. So let's go to Lisa. Good morning, Lisa.
Good morning. Can you hear me?
Hi there. Yes.
Hi. So I have a problem that I've had for many years, which is that I get some pretty severe leg and foot cramping, but it doesn't feel like it's my muscles. It feels like it's the tendons. So I also have, I don't know if it's spinal stenosis, but it sounds like it was in my back, which I've had a lot of treatments for. So I always thought that maybe this cramping was related. However, 2 doctors sent me to a vein specialist, and both of them kind of laughed and said, "This has nothing to do with your veins." So for years, nobody's been able to tell me what it is or what I could do about it. I take magnesium. My chiropractor told me to do that. Doesn't help. I've tried muscle relaxers. Doesn't do anything. Any ideas?
Well, actually, not as a diagnosis, but leg and foot cramps for years can be related to chronic degenerative disease of the spine. Do you have any evidence of that?
Yes.
And how bad is it?
Huh?
And what degree of problem is it? Do you have an X-ray finding for spinal stenosis, or what's going on there?
I've been basically told that it's arthritis.
Okay.
And they've tried doing an epidural, but this is in the center of my back. When they did the epidural, they did it in my coccyx, which I thought was weird. I'm actually scheduled for another lumbar epidural. They've also tried.
Was that for back pain, or is that for the leg pain?
No, that's for the back pain. Leg pain,
okay.
Nobody has any ideas.
Have they done nerve and electromyogram studies of your legs?
No.
Okay, that would be something to consider, getting the needles put in there and seeing if you have a connection, like a nervous problem interfering with that. That's a diagnostic technique that some neurologists and rehab doctors do. So that's one way to evaluate it. Have you had an MRI of your back?
Yes.
Okay, and if that didn't show anything that was impinging on your nerves, then it's less likely that the other thing would show up positively. But you may want to see a different neuromuscular specialist. Go to see a physiatrist who's a rehab doctor, or see if you haven't, go see a different neurologist.
Okay.
Somebody needs to take a better picture here. There's something that's missing.
Yeah, I agree. But I just can't find a doctor that can tell me what it is or give me the right suggestions for any kind of test.
Okay, this is the only time I'll mention it on the show today because people asked again and again and again last time. You can listen to the archive, but it's Institute for Functional Medicine.org, IFM.org. You can go there and use the physician finder and find a functional medicine doctor who does the deep dive like I do and finds out why you have the problem rather than just giving you pills for the symptom.
Awesome. Thank you so much.
You're so welcome. Have a great day. And good luck seeking out your answers.
Bye-bye.
Bye-bye.
And I've got Kent in St. Pete. Good morning, Kent.
Hello.
Hi, Kent.
Good morning. I'm calling because I have orthostatic hypotension, and recently it caused me to pass out, fall, and hit my head and injure myself. And I've had this for probably going on 15 years, and I've gone to primary care physician. I even think they sent me to a cardiac doctor who did several tests, including even wearing a heart monitor for weeks to see if there's some abnormality with my heart, and they didn't discover anything from that. And so they just recommend I drink more water. So I've been drinking. I put a pinch of Himalayan salt, a glass of water, lemon juice, drink that down first thing in the morning, and drink water throughout the day. But I've still been experiencing now regular dizziness. When before it would just come and go.
Did the heart doctor do a tilt table test where they put you on this table and took your blood pressure while you're standing, while you're lying down, that kind of thing?
Oh yeah, I've had that several times, and they see that my blood pressure definitely drops on standing up.
Do you have the rise in heart rate that goes with that in the syndrome called POTS?
I'm not sure.
So they would have told you had tachycardia if they found it. So you don't have that classic thing, I think. And so what's interesting is you've had it for 15 years and you have orthostatic hypotension, but no one's told you to try salt tablets?
Didn't say take salt tablets. One doctor recommended I just drink Gatorade, and I don't drink Gatorade.
Well, why would you want all that sugar?
Yeah, right. And that's just, loaded with salt. And
well, that's the point. That's the point of it. You want the salt.
Right. So I've been, so I've been taking more salt and more water.
And you're not on any medications that actually cause this, correct?
I'm on 2 medications for a blood thinner, but this has been going much longer than, because I had a stroke 3.5 years ago.
Do you have atrial fibrillation?
Had what? I'm sorry.
Atrial fibrillation, a common cause of stroke.
Dad, they don't know why I had a stroke, and
so you have a normal heart rhythm, right?
Yes, I do.
Okay. Yeah, you have some challenges here, I think there are some treatments that they haven't tried. Salt tablets for one. Fludrocortisone helps you retain a little bit more water and maintain blood volume so you have less dizziness. I think it's worth it to talk to one of these people, maybe the specialist, and find out if he wants to give you more intervention because you're symptomatic.
One of the things they did try, and they did this when I had the stroke and I was in the hospital. When I got out of the hospital, they gave me Midodrine to take to try to raise my blood pressure. And the only thing about that, it made me really ill. And they just said, well, then stop taking it.
So, yeah, there are some other options. Midodrine is one of them. I think it's worth it to continue the pursuit of more of an evaluation. You might want to see a different specialist for a different opinion about it. Go back to the heart doctor for another opinion from him, because apparently what they're doing isn't working, and you deserve more.
Right. So I did make an appointment with a cardiac doctor for later this month.
Good move.
I just wasn't sure what else that doesn't reveal anything different, but it could, since this has been going on for quite a while.
Right. If that doesn't, you might want to go and see a functional medicine doctor for a broader opinion about your overall being.
Okay. Well, that basically, answers my question and, what else I could pursue.
Yeah, I'd keep pursuing answers because you don't have enough. And let us know if you do find some. This is interesting. You have a complex issue here that needs more evaluation.
Right, and I don't want to fall again because I really got hurt from falling, and because when that happened,
remember,
I didn't even get dizzy. I just walked into another room and ended up on the floor.
Darn! Just move slowly. Remember, move slowly, and have a.
Well, I tend to do that. I try to sit up and before I even get out of bed, and sit there and actually breathe deeply and do some exercises before I even try getting up.
Yes, that is a good idea. Maybe do some leg crunches in bed or something to get your circulation going. And
right. Exactly.
Well, let us know if you find any answers, Kent. I appreciate the call.
Thank you. I appreciate it. Bye.
Thank you very much, Sarah Kent, and best wishes to you, of course. And I do have Mary, but we've got about 15 more minutes left, and I'm inviting you to participate in the Healthy Steps Radio show with Dr. Fred Harvey here on WMNF Tampa. Give us a call at 813-239-9663. I keep bragging on Joe. He's handling the phones today and doing a great job of it. So the number once again is 813-239-9663, or continue to send your emails to dj@wmnf.org. Good morning, Mary.
Good morning, all y'all. I'll try to make this quick as I can. This 71-year-old buddy's been going through it, was diagnosed with breast cancer. The same time COVID broke out, I went through 20 weeks of chemo, like a Red Devil and the whole bit, then a boobectomy, and then radiation, and then what I thought was neuropathy. Turns out, since I had an eye stroke, was clogged veins and clotted arteries. And then I thought my neuropathy was causing my leg problems. That was the clogged arteries. But having that worked on, and then they decide that my lower 5 vertebrae are disintegrating, and I have scoliosis. And must have lifted something heavy. Okay, Doc, I'm a woman. We do that. And the 2 choices I've been offered are a spinal stimulator, which didn't sound that great. The second choice was where they go in and kill the nerve in my lower 5 vertebrae, so it won't hurt when I still want to work, because I still want to work. And do you have any opinions on that?
You sound like you have some significant spinal degenerative disease. We just talked about spinal stenosis. Did they give you that diagnosis?
No, they just did.
Okay, good.
They did whatever, And then later they said, "Oh, your back's a big question mark too, but that won't hurt me because I'm old." Whatever.
Yeah. So the stimulator is an implantable device that sends electrical signals into the area and tends to keep the pain under control. The other one is what's called ablation, and they just go in and fry the nerve out and kill it, so you don't have any sensation there. Both have efficacy. I'm not sure that there's any much difference in that situation.
Okay, the one where they burn the nerve kind of sounds better, because I want to go back to work. I miss it. I was never meant to be a housewife, especially my sisters. But do you find that a good surgery for people, for the most part?
I think that the procedures do seem to provide relief. The ablation is quick and minimally invasive. The spinal stimulator, that requires a little bit of surgery. It's like a pacemaker up in your chest. They make a little pocket and stick the little thing in there and then put the thing in the spine. And so they both work, and it may be worth it to try the radio frequency first, because if it works, then you have a potential to treat there in the future, and you can repeat that in 12 months or something like that. But if it works, then quite possibly the spinal cord stimulator would be something that would give you a longer term relief. So you might want to try the quick and easy thing first to see if you get the pain relief that you're looking for.
Yeah, that's what I was thinking too. I'm not going to work as hard as I did, as heavily as I did before, but I want to work so bad. I miss it. And I got a few good years left in me, blind, one boob, and all.
Well, with that attitude, you can keep flying, and good luck with it, Mary. Go talk to your doctor.
Yes, sir, and thank you so very much. Have a blessed day. Bye.
You too. Bye-bye.
Well, we're going to have room for about one more caller. I've got a blackboard right now here, and the doc will take a look at the mass of emails that we've gotten today. But I'm inviting somebody to give us a call at 813-239-9663, and you might be able to squeeze on into the Healthy Steps Radio Show with Dr. Fred Harvey. Number again, 813-239-9663. Let's do those emails, Doctor.
Yes. Wayne asks, tell me about the use of cannabis while experiencing dementia from small strokes in the evenings. I think he means using the cannabis in the evenings. So particulate, if you're smoking it, particulates might increase vascular irritation and could cause a heart attack or a stroke because of particulates, the burnt residues when you smoke. But edibles and vapor have no particulates that way, so it's probably okay. But it's really mixed about dementia, especially this is vascular dementia. So there may or may not be any impact on dementia. You may feel a little bit more, tired or have less memory, but I don't think it's going to affect it negatively or positively. I think if you want to use the cannabis, feel free. And let's see. John asks about antiparasitic drugs. I would like to ask about antiparasitic drugs like mebendazole and fembendazole to treat cancer. Well, they're actually not treating cancer. It's an interesting metabolic story that goes along with them. And in clinical research, I found only one article about fembendazole, and it was used with another chemotherapeutic agent in breast cancer, and there was an improvement in response, a couple percentage points. It wasn't miraculous. I've seen nothing in any literature whatsoever that would suggest that mebendazole or fembendazole are actually miracle cancer treatments, despite what the Instagrifters are selling online. So don't buy into it. They're augmentative at best and not that powerful. This one's from, who is this? Cooley, it says. I don't know. I was diagnosed with primary hemochromatosis October 2025. 64-year-old female, met with hematologist, currently undergoing therapeutic blood removal, phlebotomy. Ferritin level is down to 220 from something much higher, I'm sure. Because hemochromatosis is an iron storage disease. Ferritin is the iron storage molecule, and ferritin goes up into the 400s sometimes when you have hemochromatosis. And her treating physician would like to see it down around 50, which would make sense. She had a heart attack at age 52, possibly because of this hemochromatosis that was undiagnosed. And the question she has is it okay for me to give a pint of blood so often? No, it's actually necessary. This is a treatment. You're not giving it. You're having excessive iron removed from your body in the form of blood cells. So I've seen people do it even every 3 weeks when they're really, really high in iron. And because you have an iron storage disease, the best way to avoid iron buildup is to avoid eating iron. So get rid of your prunes and your spinach. But there are no real natural ways to treat hemochromatosis. This is a genetic misstep, and you need to bleed to get rid of the excess iron that's stored in your red blood cells. Your body will make new ones really fast because it has so much iron. Once it gets down to a normal level of iron, it will slow down and you won't have to have so many frequent phlebotomies. And she does say, though, that her MRI showed no iron deposits in the liver. And so that's really good because this will go on towards cirrhosis if not checked. Looks like we have some phone callers.
Indeed we do. I've got Jay, and maybe we'll have some room for Sherry, but let's go to Jay in Oldsmar. Good morning, Jay.
Good morning. How are you today?
Excellent. How are you, Jay?
Very good, thank you, I hope. My question is, back in January 2020, I had a TIA. From there, I was discovered to have some markers by the neurologist that said I had bone blood cancer. They confirmed that down the road with that from an oncologist that no, it was only the original markers from the neurologist. The backup markers were negative. But they did determine that I had a monoclonal imbalance. And so we worked on that, and they sent me to an arthritis doctor to try to suppress the immune system because it seemed to be overactive, and I had good cases of arthritis. after a couple of years, we finally decided, well, let's see what's going on. I went in and did the full body X-ray. It came back clean, but the bone marrow came back positive. So I'm smoldering with myeloma. Now, in with this, I've had congestion for a number of years, in coughing up in the lungs and nasal, and they're asking me to consider going on Resurfi as a new FDA drug for working with the lung expansions. I just wanted to get your thought with everything else that's going on, whether that would be a product that or an advisable path to go.
So multiple myeloma is a blood cancer. It's a slow-growing, smoldering kind of thing. And your early signs of it that panned out to be negative were probably just missed. You probably had the myeloma going then. But did they do a bone marrow back in the first times that this was talked about?
Yes, they did. Then it came back positive. The bone marrow sample,
back in 2020 or 2021.
No, actually, that came back about 2024.
But you didn't have a bone marrow back in the original time when they said that it might be cancer.
No.
My suspicion is you had the bone cancer then because myeloma grows for many, many years. And because it is what it is, it's really a strange blood cancer, and not many things have actually been able to treat it in the past. One of my friends and colleagues died of myeloma 15 years ago, and there wasn't much to do, but what I understand is MD Anderson has some really interesting new treatments coming out. They've developed some stuff, and there are a lot of new things coming out about that. So I would talk to a tertiary care oncology center, which means go to a university, go to USF, go to MD Anderson if you have the resources to do so, and don't rely on local oncology, because this is a really rapidly moving field, and there might be some really important things that you have access to that at universities or treatment centers that aren't readily available locally yet.
Right. In conjunction with the oncologist here in Oldsmar, we've been back and forth with Moffitt.
Okay.
And everything from everybody is, we have to just sit and wait and see what happens with that. But my question is, for taking this Resurfi medication that is new for trying to clear the lungs and the expansions, do you think there will be any? Is that something that is viable, or is it something that is still too new, or what?
Well, most of the things that have acquired FDA approval seem to be safe enough to be utilized. Honestly, I don't know this medication as yet, nor its purpose in you, because I don't know enough about your case to think about why you would be getting this medication. That's best left to your doctors. And so, I'd recommend you really look at that. I can't tell you whether or not to take it or whether or not it's a good medicine, especially because I don't know where it's being placed in your therapeutic regimen.
Mm-hmm.
Hey, I've got to run now. We're down to the last moments. I hope you get some good results there, and have a great day.
Well, I appreciate your time. Thank you very much.
You're welcome. I want to thank everybody who called and emailed in today. This has been really engaging. I really enjoyed it. I hope I gave you some good advice and you get some good outcomes here. Thank you, Bill, for producing another great show in-house. And Joe, thanks for answering all these phone calls and keeping the people juggled for me. I'll see you next week for some more AMA.
Thank you again, Dr. Harvey, for another illuminating and beneficial Healthy Steps radio show. And to you out there, I want to thank you and all of our participants, listeners, and supporters. You make this show awesome. Of course, you've been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR news, and then get ready for the Sustainable Living Show hosted today by John Butts. Until next Monday at 10 a.m., thank you for listening and supporting the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.